Okay, it's week 4. Let me tell you some things that I did last week. Last week, I went out on Friday and I wore some high heel shoes. These high heel shoes. And what happened to me was I put a different kind of strain on my body, so my stomach started collecting water right in these two areas. So I would suggest that if you have a tummy tuck, please do not wear any high heel shoes, as well as those corsets that I keep wearing. I was told probably you should stop wearing them for a little while because all of the fluid is starting to drain down into my lower abdomen and make me look kind of poochy down there. So it's starting to go down now, but it was really big. So I'm telling you, don't wear the corsets. Wear the belly bands that the doctor gave you for 6 weeks or more, whatever. But the corsets clinch you in the center. They push the fluid down and up. So these two areas were starting to look kind of bulgy. I can sleep on my side since week 2 or 3. I could have slept on my side, but only now I can sleep on my stomach. Everything seems to feel perfect again. I can go backwards, I can go forward. Sorry, my camera cut off, so now I had to come back and do the rest of the video in the night. So it's nighttime now. First it was in the morning, now it's in the night. Okay, some questions people have been asking me. They asked me about stretch marks. Am I seeing any new stretch marks? Did the surgery get rid of the old stretch marks and all of that? Well, I did have stretch marks above my belly button. On the skin above my belly button, they were there. So now the skin above my belly button is what got pulled down to the bottom. So now the stretch marks are down here. I think as I look at them, I feel like the cocoa butter is helping to diminish them somewhat, but they're there. I don't know if you can see them. They're there. I have stretch marks, but they're kind of thin and kind of unnoticeable. And I do think that the tummy tuck helped to get rid of them a lot. Now, somebody also mentioned to me, they said they heard that when you have a tummy tuck, the sensations you get when you're touching your stomach, you feel them in other areas like in your back and stuff. I haven't had them as drastic as that, but from the moment I started cleaning my scar, like in week 2, I realized that whenever I touch the scar, I can feel a sensation up here. You know that you're supposed to have like a tickling sensation at the site when you're doing it, because this is the area that really does tickle when you're tickling it. But I don't feel a tickly sense. I feel a pressure there. I can feel myself touching myself. I can feel it. But I feel a tickling sensation going across the top right here across my belly button. So I don't know why that is. I guess the nerve endings or whatever changed. But at first, when I had first gotten this surgery, anytime I touched anywhere in this section right here, I would not feel anything. And the sensation was more up to the upper part of my stomach. I don't feel it in my back. I don't feel that like in my back. I don't feel it in any other place but my stomach. So I guess, but slowly and surely I'm getting back the feeling in this area. At first I couldn't feel anything. All across to here I couldn't feel anything, and all the way up to here, but I'm starting to feel tickling sensations right here. And it's slowly coming down. Everything's starting to heal very well. Okay, next. People were mentioning that they could see my vagina, or the mons pubis of my vagina, even though my pants is not so low. Do remember that the skin that was above my belly button was lower. In fact, my belly button was like here at first, and then he pulled it up higher. But the skin from above where my belly button was got pulled down, and the skin from below down here got pulled up to join to that skin. So everything that was down to the bottom here got pulled up higher than it's normally supposed to be. So excuse me that you can see that, but it's not supposed to be there. It's not anatomically correct. It's abnormally high for that area. That's all I'm saying, because it's supposed to be like down here, but the hair is all the way up here. That's not supposed to be there. One thing I'm happy about is that I always had like a trail of hair down to my from my belly button all the way down to my mons pubis, but now because the skin above my belly button is down here, I don't have that, so I don't have to worry about shaving that area anymore. Ooh, ooh, work it out. Yeah. Anyway, that's one thing I'm very happy about. Next thing I have to say, I want to talk about care and maintenance. Yes. Care and maintenance is pertinent, because if you don't take care of this, you're gonna mess it up. I was talking about itching. At 4 weeks now, it's starting to itch all the way across the scar, and I know that it's itching, but I'm not scratching it, because if I scratch it, all them germs in my nails are just gonna destroy what I worked so hard for. I stopped working out because of my shoe incident, because I was starting to develop water in these two areas and up here, and I stopped really using tight corsets. So I'm gonna go get back to that like in a few weeks, but right now I'm just letting myself chill and letting the water drain out naturally like how it's supposed to, so I wouldn't have any complications. So let me talk about care and maintenance. I'm gonna actually give you a view of my scar today. I have tape on it now, but I'm going to take it off just for you. I use alcohol or peroxide, doesn't matter. I use alcohol on a Q-tip, and I clean out the inside of my belly button. It's important because a lot of stuff, lots of bacteria and all that kind of stuff gets trapped in there, and you want to make sure to clean it out. And it's hot because it's like almost inside your body, so all the germs and stuff like that get in there. So make sure to clean out your belly button. This is for anybody. Just make sure you clean it out. The next thing I like to do is to actually clean my scar. So here's the unveiling of the scar. It's 4 weeks and my scar is not perfectly healed yet, but I can't wait to actually... Ow, 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 ow! I gotta shave. Woo. Wow, that hurt. Okay, suck it up and be a woman. So here's my scar. It's kind of dark right now, but it was really dark at first, and it's getting way lighter now. So what I do, let me come a little closer. It's not so bad. It's getting really flat now, and the color is starting to fade out, I noticed. And my skin likes to keloid, so I figured out that that's why he turned my stitches inside instead of outside. So I take some alcohol or some peroxide on a cotton ball and I clean it off. I noticed that my scar hurts most on either end, so like this end and that end, it hurts the most, but it does not burn at this point. It doesn't burn. It didn't burn from day one, actually, for some reason. I don't know. It never burned, but I clean it off. I dry it off. And I'd either at this point, if I want to put back on the tape, which I do, because this tape actually helps to flatten out the scar and reduce the appearance of scars. And I believe that around 2 months or so, I probably won't even really see a scar. And I'm hoping. But I do plan to get a tattoo covering it. I want barbed wire and roses. So later on, maybe I will cover it up and you will see. Anyway, so I'm going to take my tape and I'm gonna put it on there. I should have shaved first. I'm going to have a hell of a time taking that off. I break it into 3 pieces because the part in the middle is a little curvier. And that's about it. Then I would actually put the antibiotic ointment on top of this tape and let it seep through, which has been working pretty fine for me. It does not hurt anymore. I can actually press it. All in here doesn't hurt anymore. Just this spot hurts for some reason, and right here hurts. That's about it. So there you go. That's care and maintenance and all the things I have to report this week. Thank you so much for watching. Mwah.